Telemedicine, it means that it's healing at a distance, and first time it was used in the 1970s, but still 2007 there was no definite definition what kind of this topic covers, and in 2007 World Health Organization adopted the following very broad description: that's the delivery of healthcare services where distance is a critical factor by all healthcare professionals using information and communication technologies for the exchange of valid information for diagnosis, treatment, and prevention of disease and injuries, research and evaluation, and for the continuing education of healthcare providers, all in the interest of advancing the health of individuals and their communities. So the description is very complicated, but there's four main points that describing this telemedicine. It's to provide clinical support, it's to intend to overcome geographical barriers and to connect the users and doctors and patients all around the world, and it involves that it uses the information and communication technologies, and the main goal of that is to improve healthcare outcomes. The origin and the history of the telemedicine begins in the 19th century. Then there was first tries to send via telephone lines electrocardiographic data. And the first published data about the successful things, it was in the beginning of the 20th century. It was done by Eindhoven in the Holland. The telemedicine as we use now was started in the 60s, and the main thing what was driven that it was the starting of the space programs around the world and also military technologies that needed the medical care far away in the space or even as far away in some battlefields. The first things that we were using, it was a television to consult between the specialists. This is one of the examples of the telemedicine in the space. Telemedicine is not only easy thing. We have a lot of barriers, and these barriers are very different around the world. So what kind of barriers we have? We can divide it into two types. While developing countries are more likely to consider the resources issues. They have no electricity somewhere, they have no internet connections, they have no computers. So the technical and money problem is the number one for them. That could help with the developed countries. And for the developed countries, it's also a lot of problems, but these problems are made by ourselves a little bit because of it's legal issues. We have to be sure about the patients confidentially and all the ethical things about data transfer through the internet. In 2009, there was a World Health Organization survey. It was the first survey about what is going on in the telemedicine world, and it was done in the 114 countries. It was 59% of member states, and there was some recommendations and also results of that after the analysis it was recommended by the World Health Organization that member states should capitalize the use of information and communication technologies to give it support to more and more to use in the daily practice. And also it was recommended to create a national agencies for coordination of telemedicine and other healthcare electronic healthcare initiatives. And it should be a part of integrated healthcare services for all the community people. And the best describing what is the purpose of a telemedicine, that its telemedicine initiative should strengthen rather than compete with the other healthcare services. In our hospital, we have a project for the telemedicine, and the essential event for our project was in 2012 when the first physician of Kaunas clinics went to the Department of Hematology and Oncology in Leipzig University Hospital for core training in hematopoietic stem cells transplantation. During the period from 2012 and 2017, 4 hematologists were trained in Leipzig, ranging from 2 to 6 months. And also our medical biologist responsible for the processing of hematopoietic stem cells was also trained in Leipzig. We also had regular visits by Professor Dietke Niederwieser to our department. This is the picture from the first meeting with the Professor Dietke Niederwieser in our department. So doctor's training in Leipzig was an essential thing to start our telemedicine project. It let our doctors to know many details about the patient care at our partner center in Leipzig. So we all could understand what we are doing and we could speak in one language for the patients. And our project of telemedicine was started in the autumn 2015. At that moment, Kaunas Clinic started autologous hematopoietic stem cell transplantation for multiple myeloma. Introducing new and sophisticated treatment modality in Kaunas Clinics was a responsible work for all the personnel, and we were also had to have help from other teams from the hospital that let us do it safely. It was from the laboratory, radiology, gastroenterology, and other departments. So our main spot was the patient safety. It's not America first, but the safety first. It was here, and the safety of our patient was guaranteed by our staff that had excellent training in one of the most advanced centers in Europe. It was in the Leipzig. Daily, even weekend and bank holidays, teleconferences with the Experience Center in Leipzig, with the Dietke Niederwieser, led us to even more improve safety and quality of our transplantation program. So what are the benefits for our patients? Patients can get highly experienced care closer to their home. They can stay closer to their families. They have less social and economical stress during intense treatment. Patients are consulted by the medical professionals who are in the hematopoietic stem cell transplantation for many decades and have experience that no other center in Lithuania can provide. What are benefits for our doctors? Our doctors are safer too. They can get reliable advances in fast track. Doctors can discuss cases and get experienced solution for our problems very quickly. So how does it work? It's very short movie about how...
Hello, Professor. We want to present you our UPN number 13, Bekampiene. Today is day plus 18 and she feels quite good. She still has loss of appetite and general weakness. Her vital signs are normal: systolic blood pressure 133, diastolic 77, heart rate 90, respiratory rate 15. She has no temperature, and in physical examination everything is normal. Her weight is stable and hemoglobin 95, leukocytes 5.28, platelets 90, potassium 4, natrium 141, creatinine 65, urea 2.6, and liver enzymes are normal and everything else is okay. So we are continuing with prophylaxis. Fluconazole 150 twice, acyclovir 400 twice, omeprazole. We did chest x-ray for today, and our radiologist saying that everything is normal there.
So that's look like our everyday conferences with the professor. We also have some limitations because of the telemedicine, first of all, and the main thing, that is a distance. Our colleagues are far away and they cannot touch the patient. So they rely on our experience, and I think they rely on us in this case. So this project led us to make more than 30 transplants from 2015 till today. And this cooperation is unique in all of the world in the field of hematopoietic stem cell transplantation. Our project was also discussed in the World Health Organization meeting by the Professor Dietke Niederwieser, and it was suggested like a model for the cooperation for other countries. And also the JC regulation are now on the discussion about the telemedicine in the hematopoietic stem cell transplantation regulation. So the telemedicine is not yet teleportation, but the future, we don't know what will be. So thank you so much.